Ahead, Carrie. So what we'll do is Carrie will present, and then we can have questions, questions and answers.
Hi, May. Hi, everyone. Good evening. I just wanted to clarify our community school District 1. I'm the superintendent for District 1. And so there are 19 schools under my portfolio. But anyways, I just wanted to say Happy New Year. Thank you so much for having me. I shared with Arnett that I'm happy to be back as many times as you would invite me. So thank you, and it's great to see you too, Susan. Thank you so much for everything. So I just wanted to, there's really not a formal presentation. I really want to have a really authentic dialogue with the board. But we have really successfully reopened school post-pandemic and obviously in September, and welcomed back at least 6,500 children. Our children were really excited to come back to school. Our staff, everyone's really excited and really looking forward to a consistent, uninterrupted school year. And so I know that we wanted to talk a little bit about, the needs of the school district, and I'm really grateful that we have so many advocates here who are going to, fight for what we need, right? And so one of the a big need in our district is the decrease in enrollment. We have lost many children to, for a variety of reasons. So our schools are really shrinking. And so, and we all know the challenges of small schools with really limited extracurricular activities, limited staff, limited programs. So the declining enrollment, not just in District 1, but across the city, really posing a significant challenge in our schools. Do we have an enrollment plan to recruit parents and children back to our public school system? Of course, we do. But we also ask that if you have any sort of social gatherings or any events that I can attend to really promote our District 1 schools, please invite me. My team and I were ready to knock on doors to really promote our wonderful D1 community. So the loss of enrollment is really a real thing. And I really hope that together we really promote the wonderful programs that D1 has to offer, and just the public education. I think we've done an incredible job reopening school, even just during the pandemic. I know, there were a lot of conversations, remote, hybrid, and so forth. But being the largest school system in the country, I really do think that we did a really a good job in preparing our children back to school. So again, I think if we can just focus our efforts and really working with our families to bring our families back to the public school system, that would be really helpful. The second piece that I wanted to, I've been talking about this actually for a couple of years, is the need for universal childcare. Many of our families are returning back to work full time, and they need childcare and after school care, right? And so not all of our schools have free after school programs for all of our children, especially our K-5, our elementary school. And there is no free after school program right now currently for 3K and pre-K. And we all know that our parents want to go back to work. So I think that's a really important ask as well. So on our end, what we have done within our control is that we are asking for private funding. We have really special partnerships with Essex Crossings, with Trinity Church Wall Street, who have really provided private funding and do the best they can to help us with some after-school program. But is it sustainable? No, it's not. So I hope that we can really advocate for that. And talking about private funding, last summer, many of our families it find it challenging to get a seat for Summer Rising. I'm not sure if you heard about the challenges in getting a seat for Summer Rising, how the seats were all filled up and parents were kind of left, not knowing what to do with their children during the summer. And what we did with District 1 is that we were able to secure a private grant in collaboration with Henry Church Washington, and any family who didn't get a seat was able to get a free summer program Monday through Friday from 8 to 4 p.m. And so it was really, I think Arnett, I think you know a little bit about this, the City Trekkers program where we took all of our children across the city in trips and we chartered private buses and it was an incredible opportunity. And so we know that we have private partners who are really willing to help, I apologize for the Boston. But also we need some sustainable funding. So I think those are the two really key pieces that I hope we can all work collectively to really advocate for on behalf of District 1, but also for the system as a whole. That's my piece from here, and I'd love to take questions or comments or anything.
Questions? Susan Stetzer.
Sure, thank you. I have a two-part question. So first, are we losing a higher percentage of kids or more kids than other districts?
It's comparable. Every district is losing a lot of children. So in comparison to other districts, I think, we certainly don't there's no flag that this one is losing the most amount of kids. I think, average every single district has really experienced a loss in enrollment. And the reason is housing, using that affordable housing is really less and less, as you know, on the Lower East Side. So it's a variety of factors. While we have a lot of new developments, which I keep talking, they're often not having children is actually, the different, sort of families moving in. So there's just a lot of factors that are impacting. And enrollment has decreased so much that the girls, the charter school, girls prep, as you know, is consolidated. So it's also affecting charter schools as well.
Well, one of the reasons I asked is because, the city is finding places for the asylum seekers coming in, and they are Spanish speaking, and the city just this week is placing kids, Spanish speaking kids in PS 130, which I know is a great school, but it's not going to be as easy for them as far as language access. And I wonder, I know DOE is working with Department of Homeless Services, but I wonder if there's any conversations about that within DOE.
So PS 130 is actually under Superintendent McGuire, and that's District 2. But we do, for under my portfolio of schools, we are also welcoming asylum seekers as well. And so in District 1, we actually formed a team just to onboard new families, to make sure that they have the resources that they need, to make sure that we have our ENL teachers placed in all schools. Professional development is actually, pretty robust in supporting our teachers and supporting our multilingual learners. We also have pantries set up in all of our schools, and we know who they are, and so we have seats, so we are welcoming them open arms. And so for us for District 1, we're really diverse. Our schools are very diverse, so it's not like this huge sort of shock, for
I'm
any of
more
our
concerned
schools.
about the city's policy of not of just kind of checking a box where they find beds as opposed to,
Right.
looking for, and I didn't know if there
I
was
can
any.
just speak for District 1.
Yeah, and then
So-
the city has to do it. I actually called the mayor's office of immigrant affairs to get them involved. But I just think that's just an issue that should be taken into consideration. The one other thing I wanted to mention to you is, the community board has a charter mandated district need process for our district. And it's generally in July and September. We would love for, to hear from District 1 on both capital needs and other needs that we often advocate for, such as do we have enough social workers? Do we have enough nurses? Definitely aftercare. So if we could touch base in July and September every year, that would be great.
Susan, I have the list ready. You know, we are constantly progress monitoring and tracking very carefully the social emotional needs of our school. So I'm happy to join the conversation whenever you can.
Thank you.
Thank you.
Well, Larissa, okay, Larissa, and then, Larissa, you still have, Larissa's hand is not up. So Arnett, Larissa, have you changed your mind?
Well, it was regarding our asylum seekers, the impact, but I guess I would like to have a little bit more information on the financial impact for the schools. Are you able to, is there a plan in place for appropriate funding for all the services that the students need this year? And there's going to be an increase in these students coming into our schools. Has there been a conversation with the DOE regarding increased funding for the following year for these students?
Great question, Larissa. So where we're at, I actually take it year by year. The fact that we're not held accountable to enrollment loss and the city didn't take back money for the design, we're super grateful for. But in terms of the financial resources for asylum seekers, I think, again, I speak for District 1. We keep a really close watch on that. And again, we have a committee in our district, where we are monitoring. Obviously, we can't sort of, there's no specific sort of like, hey, there's an asylum seeker coming now, so it's really like, so we monitor our children in temporary housing. And so our principals know who to reach out to. If they need additional financial resources, we know where they're going. So we're really trying to how we can control is the communication gap, right? So we know, and then we respond. There's a direct person that I speak with in Central. I know who she is. I have her on speed dial. So, in terms of, as long as we know, we're doing everything we can to make sure there is no gap in services. So I think we're keeping our system like super tight, and that's the advantage also of a small district, right? Like we really can monitor the influx or decline very, very closely.
Yeah.
And in terms of for next year, hopefully, hopefully there is additional resources coming. I don't. There's no way that the federal government is not going to step in. There's just no way. But I know for now, we haven't been denied any funding. So that's where we're at right now. January 5th. So.
Yeah. Okay. So just before Arnett, one more thing on the asylum seekers. So, I know that they go to schools that are not necessarily near the hotel or shelter where they're staying, because I know they're like that hotel in Midtown. I mean, they're not going to the Midtown schools. They're maybe they're on the Lower East Side or East Harlem. So it would be good to get to know just how many you're getting, and then, as you probably have heard, Carrie, that hotel on Grand Street, they're planning to,
31 Grand Street.
Yeah, they're planning to turn it into this, like, another, place for them to stay. So it will mean more downtown, right? It's physically in school district 2. but not too far away from one. So
Come.
potentially they could
We have
they
feet.
could just go over to one. I mean,
Come.
they have to walk over a little bit more, but
Yeah.
they potentially could.
They-
It could
they-
happen.
They haven't, they've already been assigned
You know.
and DHS keeps them. So some of the asylum seekers are with DHS and some with another agency. So the ones with DHS are automatically put at the nearest schools. And they have already been assigned to 130 and 131. And, maybe we can get involved in trying to get the policy changed, because you're absolutely right. Why shouldn't they be going to another school down here?
So busing is a whole different sort of conversation. The transportation has been really tricky. Even, without asylum seekers, even for our children, who need busing. Even, it has been really tricky to get bus drivers. There's a shortage across the city. So in terms of, choices for asylum seekers to go across town or other choices, I think we can definitely work on that. But in terms of transportation, it's very limiting in terms of choices for them. However, I don't have any data to support, what I just, what I'm saying, but I can only imagine that that's a challenge.
Okay, Arnett?
Hi, hello. Hey, Carrie. Two things. One, I want to thank you for taking this time. I know your schedule is really hectic right now. I appreciate you coming out. One of the first things I wanted to discuss is on a more uplifting note. I wanted to discuss for you to take a time to talk about the IB school that we have, Global Leaders, as well as how does that translate to us possibly getting more families interested in our district? And secondly, I also want to know what would be your ask of the community board? Like, if you can really just hone in, what would you like for us to be able to assist and advocate for in order to maintain and improve the standards that we currently have in our school?
Thank you so much, Arnett. That's such an important conversation. And I think that, I'd be happy to invite the principal of this group of Global Leaders who just received an IB approval, which is amazing. We will have our first IB school in the Lower East Side ever. And so I would love to have the principal come and present to the community board if you would like, so that she can share more about the process, because it's such a rigorous process. And it took them, I believe, 4 to 5 years for them to be officially approved to be international baccalaureate school. And so, Arnett, thank you so much for bringing that up. And so, international baccalaureate is known, if we know about it, is really an access issue, right? Affluent families have access to IB programs. It's usually implemented by private schools. And so that's why so few public schools in New York City that are actually IB approved. And I believe that, and I'm right, that Global Leaders will be the first approved unscreened IB school in Manhattan. And the data has shown that students who go through the IB program have access to a variety of colleges. And so we know how important it is to also have a 6 to 12 school, because right now Global Leaders is only 68. And we're hoping to, and Arnett, I think I shared with you that we have the blessing from Central to start community engagement. We're actually starting in March, so this is perfect timing too, to really co-construct and co-imagine what a 6 to 12 IB school can look like, right in the Lower East Side. We're incredibly excited. This will give our students more access. and more just different programs, which I also think that it will also help with enrollment because now we have dual language, now we have IB, we have gifted and talented, we have art schools, so we just have such a variety of programs and courses that really, again, make District 1 so unique and special. But you let me know um, if you would like the principals to come and share with you a little bit more information about the IB. But right now, we're still in the planning phase, and how we can support is, we would love to keep everyone updated with our engagement process. And we would love to have any sort of opportunity to be in front of the community to share how exciting and important opportunity this is, just to gain some more support and excitement around this opportunity because we do have folks that don't know what IB is yet. So we would love to spread the word.
That's the one.
Also point is, I founded this group of global leaders, so it's a little biased there.
Is that the one that's in the building with Lower East Side Prep?
Yeah.
Okay, so it's where
And
the
it will-
Marta Valle School used to be, right?
Yeah, so there's tons of room, and our families are asking for also a 6 to 12 program. And so we're really excited. We're excited to begin the engagement process. Of course, it has to be approved by tech. But again, I think it's super responsive to the needs of the community in so many different ways.
So that's in addition, the 6 to 12 program is in addition to the IB school, which is a middle school.
It would be IB from 6 to 12.
Oh,
So,
okay.
Yeah, I'm sure we know about the Clinton School.
Yeah, we heard of it. Yeah, I know.
Yeah, the
It's the
Clinton
one on
School.
15th Street.
Yeah, so that school, actually, the IB program is for the only high school. And so they're a 6 to 12 school. So they're not IB for their middle school.
Mhm.
And so for global leaders, they're actually IB it's going to be 6 to 9. And then they're going to have to reapply for IB for the high school portion. So it's different,
Oh,
but very interesting, right? And there's a
okay.
huge waiting list for the Clinton School. So, we're hoping that this will increase access.
Okay. Also, can I ask you about something that Arnett mentioned at a previous committee meeting? Like during the pandemic, there was a lot, after the pandemic, there was a lot of like learning loss and reading loss and math loss. And I thought she said that school district 1 was going to somehow research or look into how this reading loss has affected them. So we want to know more about it and like what's needed there.
So that's a long conversation in terms of, a loss of instruction and the loss of just everything, right? And because of the interrupted learning, our students really need the foundational skills and the foundational support, not just for in reading, but for math. So that's why we're having one of our district-wide goals and citywide goals is really focused on foundational literacy in K-2. That's right. Can I also put a plug in? One of the mayors, and I really, that really tugged my heart because literacy to me is equity. Literacy is access. When we talk about equity, that's literacy. And so, hearing that there's a strong appetite and movement towards making sure that all our children can read and write and do math on grade level, that's my purpose. And so I would like to have a dyslexia program in District 1. And so I know they're piloting different programs, and I believe that we are in line to be piloting. But I think the more continuing services that we can provide early intervention for our children will really make sure that they are reading on grade level by 3rd grade.
Well, when you say dyslexia program, you mean like a program in every school, or it's like a school? Because people talk about different things.
I know. Is it a growth program or school or whatever? For me, it's just a service. Like, as long as there is a service to for my most struggling readers, you know, that have been diagnosed. Again, like,
Mhm.
you know, we're working on, you know, actually training folks to really, because dyslexia is a really small percentage, you know, but also we're very careful in using that, right? But also that service should be there. So, you know, either a program, school, whatever it is, you know, as long as that there is, there's a service for this issue, and, you know, bring it on. To the Chippewa. Bring it to the Chippewa.
Okay.
You're gonna keep me on. I'm gonna have 5 more wish lists, and, you know, I'm gonna come back. I'm gonna ask for more.
Okay, no, that's, yeah, I think so. Are there any other questions? Raise your hand. I don't see any hands raised.
Oh my, is
Okay.
that Harvey that just popped on? I'm sorry, I didn't mean to call you. Oh, Harvey, Happy New Year. Harvey is my, well, my awesome, the best community advocate ever, elected official ever. Just so that you know.
All right.
Thank you,
Okay.
Carrie, and Happy New Year to you and everybody.
Okay, so it looks like, Carrie, we don't have any other questions. But you know, you've told us a lot today, and I think there's a lot for us to continue to connect about and keep in touch about.
Yeah,
Right,
and thank you so much for having me. And again, please extend the invitation, and I will join and keep everyone abreast. And you know, we've come a long way together, and we're family. So just let me know, and you know, I'll be here. So thank you for being here for us too.
Okay, thank you. Have a good time at the bowling alley.
Oh no, hockey. It's my children's hockey training.
Oh,
Yeah,
okay, okay,
yeah. I know which.
okay. All right. Okay, bye-bye.
Thank you. Bye bye. Good night, everyone. Take care.
Good night. Oh, okay, great. So our next agenda item will be Mount Sinai Beth Israel. We have Brad Beckstrom and Brad Korn to give us an update on the hospital. So that the way it will work is that they will give their presentation. Then we will have questions and answers. I'll take questions from the committee members first, and then everybody else later. And then, as usual, there'll probably be like back and forth. I mean, when I say, you know, I might go back to the committee or back to everyone else, because not everybody raises their hand at the same time. Okay, so I know that people often have many questions for, you know, Mount Sinai about all kinds of things, but I think the questions should relate to their presentation. Not I think, tonight's presentation is about the hospital. You know, the plans for the hospital. So your questions should relate to that. Okay, Brad?
Okay. First of all, Happy New Year, everybody. And for those of you keeping score, Kevin McCarthy did not win the 11th vote in the House of Representatives for the speaker. Just figured I had it on the side, I'd let you know. So there's a few things we want to discuss tonight. So let me start with, first of all, the actual plan for the transformation for Mount Sinai Beth Israel and downtown is still a work in progress. We don't really have anything to discuss about that tonight. The only thing that we're still consistent with is we're not closing New York Ioneer and we're not closing Mount Sinai Beth Israel. So let's start first with the most positive aspect. The facility on 45 Rivington Street, construction continues on, and we are scheduled to start opening. It's not going to be an all-in-once opening, but a segmented opening sometime in the second quarter of this year. And of course, one of the things we're really happy about is there's going to be respite and crisis beds at the facility. So things will be starting to move a little more. Construction, as you know, nothing ever goes completely perfectly as you're going in New York City, but we're still going to have, we expect sometime in the second quarter, we'll be moving some programs down there. So tonight, really, I got the inference is more a combination of a little bit about Beth Israel, but also about New York Eye and Ear to an extent in some of the programs that are going on with the two of them. So let's talk about 3 certificates of needs that have been filed. We'll start with the one that's going to be the longest off the road, and that is we are starting hopefully soon, and Brad Beckstrom will jump in with some more technical details or if I miss something, with an ambulatory surgical center on between 24th and 25th on Broadway, where once it's open, and the earliest that'll be is a year, it's probably more like sometimes between a year and 18 months, we will be moving some eye surgery, outpatient eye surgery over there to be done there. Another CON that we filed is to expand ear service at our Union Square facility with the intention that some of the programming that's going on at New York Eye will be there as well. The third one, which sounds more draconian, but it has a good basis, in fact, is we have filed to do an asset merger between Mount Sinai Beth Israel and New York Eye and Ear. And a lot of that really is it will not change the operations of what's going on in New York Eye and Ear. In fact, the CON even calls for it continuing as doing business as New York Eye and Ear. It really is to protect the finances of New York Eye and Ear, which has taken some big hits lately. And by doing this, we'll protect its integrity and be able to continue on with the services we want to do. That could be coming up as soon as this month. We don't get notification from FIPIC. That could be coming up this month, more likely later in the year. So that's kind of where we're at and what we're doing. And understand that part of this is we are trying to improve the facilities and the areas of, where people are getting service for the New York Eye and Ear community. And also keep in mind, while New York Eye and Ear sits in Community Board 3, we service people from all over New York City. Even Community Board 3 isn't the largest group of people we serve there. So when you hear of programs moving a few blocks or moving a little bit out of CB3, for everybody we're kind of inconveniencing, we're making it more convenient for the same amount of people. So it's not like when we talk about Mount Sinai Beth Israel, it really is a citywide service. So with that, I'm going to let Brad B jump in and see if I've missed anything, and then we'll happy to answer what I'm sure are a number of questions.
I mean, I think, Brad, I think you covered everything. The only thing I would add is when you talked about at Union Square, the expanded Ear Institute area, that likely would open mid-year of this year. Again, the timeline is flexible. But
that's why I tried to go with the one that was the furthest off first, and the one that was most likely to come up the soonest as last. So that was fresher in people's minds.
Yep. And when Brad mentioned, just to clarify, coming up, the FIPIC agenda, the one CON that has to be approved by FIPIC, which is the Public Health and Health Planning Council, is the merger between New York Eye and Ear and BI. And as Brad said, we do not get advance notice other than a week prior to when that's on the agenda. The earliest that would be January 26th, but it well could be March, April, or even May, June.
And Susan, to go to something that you had talked about before when you sent in the, when we set this up with the email, is you'll be able to then you can go to the meeting and give public testimony. And I also believe you can send in testimony as well.
Yep. And we can give you, Susan, offline the address if someone wants to write
and you
comments,
can send it out.
Yeah, where that can be sent. Or, somebody can show up at the hearing and testify at the hearing and make comments.
You have to show up in person. They don't have virtual stuff.
Usually they've gone back and forth. As of late, it has been in person and it has not been virtual. It is in person. During the height of COVID, it was virtual, but they've gone back now to in person. But again, I can't say for certain what it's going to be, this month or next month or in March. It's up to DOH.
But they will take whatever written testimony they receive as the same as if you were there as
Yep.
well.
Okay, did you have anything else? Brad?
No, I mean, I think that covers it, unless Brad Korn, you have something, but I think that those are the key things. And, the big message is the overall downtown transformation. We're still working on that. And, once there's a more definitive plan, we'll be back in touch.
And we have been increasing our ambulatory footprint downtown as well.
Okay. All right. So in that case, I will start taking questions and answers. Arnett, you put your hand down, right? So I guess we'll have Susan.
Okay, thank you. I'm asking this very informed as a consumer. At the ambulatory center, it seems like you must be running out of space there, and you have programs that I know are kind of overwhelmed and actually need expansion. And I'm wondering why you're doing that instead of moving, why you're moving services in there instead of expanding where you have a need already there.
You're
talking about Union Square, right?
Union Square,
Right.
right?
Right.
Well, one of the reasons we're doing it, and I'm gonna let Brad go into it also, one of the reasons is it allows the people who are getting their ears remember, I'm not a doctor. I don't play one on TV. I don't play one on Zoom. The people who are going there for ear appointments and that can also get other services while they're there. They can get their primary care. They can get physical therapy, as so there are other things that they can arrange. So it makes it a little more of a one-stop shop, just not hearing issues as well.
Yeah, better continuity of care, exactly.
Okay, so my concern is that you really don't have enough space there to accommodate. I mean, I understand what you're saying, and I appreciate that. It just seems like you're running out of space there.
I mean, fair point. I mean, space, honestly, Susan, is a challenge everywhere we have. But, we are able to move certain things around. We are able to move some administrative space off to expand the clinical space. But it's always a domino. I mean, Brad, add anything else, but that's a challenge everywhere, every site.
Yeah.
Thank you.
Okay, Arnett, did you have a question?
Got to go off mute on
Yes.
that.
Yes, I'm trying to formulate a couple of questions, or at least narrow down to two. One, I was listening and hearing that Ioneer it's hemorrhaging money and/or not doing well financially. But I'm also listening and hearing that 10 Union Square, they're and the other spot is expanding on ambulatory and ear services.
The ambulatory surgery center will be a new facility that is being built. 10 Union
Okay.
Square is an expansion of services within the already existing facility. Just so we clarify that.
Okay, because what I'm really trying to make sense of is if eye and ear is not doing as well and your BI Mount Sinai is going to now merge and oversee it, are you going to be able to fix the issues that are hemorrhaging eye and ear instead of having people from the vicinity go to other spots like 98th Street, other Mount Sinai locations, and try to keep that central, but keep that downtown as far as not having people.
The
having
eye
to
and ear
travel.
services
Mhm.
that New York Eye and Ear, the intention are they will remain in the downtown perimeter below the 34th Street as part of our downtown plan. It's that and Brad, correct me if I'm misspeaking, but as for the ambulatory surgery stuff, that's all planned. It's a better facility, and they're not just going to be doing they're not just going to be doing eye surgery there. I believe there'll be other ambulatory services incorporated in there as well.
Primarily ophthalmology, but there could be some others. Yeah.
Okay, thank you. I was just trying to.
No, a
comprehend
fair
looking
question.
at
It's
student
not, it's
services.
not to disperse the programs throughout all of Manhattan.
Okay,
It's to keep them in keep the New York Eye and Ear services in the downtown area. And as I said, even though people do come from 98th Street, it's that where we're moving, like even moving to Union Square, it's a little easier to get to Union Square than it is to even get to New York Eye and Ear. There's better public transportation to that spot. There's just, there will be some people who are inconvenienced, but there'll be more people who are convenienced by the move of these locations.
Yep.
okay, thank
Thank you.
Okay, next. I don't see any hands raised. If you have a question, you ought to
Looks
raise your
like Paul
hand.
has his real hand up.
Okay, Paul.
Hi,
Okay, I
Brad.
don't see
Hi,
any,
Brad. Brad,
yeah, I
how are
don't
you?
see any committee members, so I will
Oh, okay.
take them. I don't see any right now, so Paul, you can go ahead.
How are you, Brad? Brad, I don't know if you've heard of me or if, we haven't met, but I'm the president of the New York Eye and Ear Alumni Association. I'm also involved with residency training. I'm an associate professor. So
I've heard your name, Paul.
okay, good. So I'm in close contact and relationships with Jim Tsai and Paul Sidoti, and I don't know if you're kind of the messenger, so I don't know if it's the appropriate question to ask. I've met with Jeremy and I met with Liz privately, but you know, the CON to merge the certificates of New York Eye and Ear and Beth Israel is a move to basically relocate the services out of New York Eye and Ear. At least that's what I've been told. To relocate because of the hemorrhaging, they would like to make a transaction, financial transaction, cash out on the real estate valuation of the current location.
Right. So, you know, addressing a couple of those, and Brad Korn jump in, you know, the primary reason for the merger is financial, and it really has to do with reimbursement. Getting a little more into the detail, Paul, and I'm sure you're aware of this, is that New York Eye and Ear virtually is a outpatient facility. Its inpatient census is very low. And there's a joint commission requirement that in order to maintain your inpatient status as a hospital, you have to have an average daily census of a certain level. And New York Eye and Ear is right on the verge of losing that inpatient status. So by merging, it does help with reimbursement. I mean, that's really the key thing. The second thing with regard to real estate, there have been no decisions on any real estate downtown that will be sold or will not be sold. There are no decisions there at all. And, you know, that all ties to what is the overall plan for the downtown transformation going to be? And that has none of that has been decided yet. And Brad Korn, correct anything or add.
And Paul, we've told Community Board 3 and we've told Community Board 6. Clearly, once the transformation plan takes place, there's going to be real estate that will be offloaded. And the profits of whatever real estate is offloaded are going into the transformation.
Okay.
But there have been no decisions made to what property, what facilities, or whatever. And at this moment, the only facility that is being emptied out at this point is going to be Bernstein at 10, Nathan D. Perlman Place, once 45 Rivington Street is fully open. But other than that, no other decisions have been made. So I'm not discounting what you're thinking, but I think you may have interpreted what they told you a little bit more so than it really was.
So then somebody has to explain to me why we're having meeting with the residents monthly with Mount Sinai leadership, Paul Zucker, Barbara Brennan, Jim
We
Tsai.
understand you are.
Yep. Okay. So somebody has to explain to me as associate residency program director, where we've had meetings where they've told us that all the OR cases that residents are doing will be moved to Beth Israel, and the clinics where thousands of patients are being seen at 2nd Ave and 14th Street at the current location are supposed to be moved to another location where their lease fell through, which was obviously poor planning on their part. So I've been on meetings, Brad.
Okay,
and Brad.
I will,
Okay.
when
I've been on meetings. where
Go
they
ahead.
have told us that we are moving our ophthalmology or cases that residents do to Beth Israel, and the resident clinic is being moved to 382nd Ave. And surprisingly enough, that negotiation is on pause and fell through. Again, poor management and poor planning. So no decision has been made, but you can, and we're gonna have to get to some point where there's this dance and this deception is put to an end. And I don't know if, you're the messenger, so I can talk to Jim and I can talk to Paul. And the reason why we have people from the community here is because I let them know, look, why would you inconvenience so many patients that have been going to the same location for many, many years? Why would you inconvenience them? I've even said this to Sinai leadership. Whenever you move any healthcare facility, even a small doctor's office, it's hard for these patients, especially the visually and hearing impaired patients, to move to another location.
Okay,
They have not been
okay, so
able to
Paul,
provide us,
we're not-
they've
Paul,
not been able
okay,
to provide. they've
okay,
not
I'm
bypassed Paul.
gonna interject right here. Okay, I'm sorry I didn't mention this, but there is a 2-minute limit. And, but I think that you seem to have an ongoing conversation, which probably needs to continue. But right now, since Paul, as you said, there are many members of the community and the public here. I would like to hear from them. Does anyone else have anything, because we're already at 7:25. So we've, heard I would just like to hear. I mean, I know a lot of people talk to the community board before this meeting. I know they have a lot to say. And we'd like to hear that too. We have many organizations here and, community leaders, one elected official here. So,
Mark has his hand up.
Mark,
Yeah.
Mark Hannay, go ahead.
Hi, Mark Hanna, I'm a resident of the community, and have been outpatient a few times over my 40-year residency here, at New York Eye and Ear. And I've also have been active in the coalition that came together a few years ago when the proposal from Sinai to radically downsize Beth Israel into a new hospital, which has since been abandoned. So I guess I'm more of a comment rather than a question. I'm glad you're here explaining this to us now. And I think Paul has been working with some of us in last couple of months around all this stuff to keep us informed. But I think we're a little concerned that once again, we're kind of finding out about this either secondhand or sort of as a plan has already been developed, rather than sort of bringing the community in from the get-go and saying, hey, we have a problem around the finances of New York Eye and Ear. Here's what we're thinking. Let's talk. Does this make sense for the community? Et cetera, because we had a similar experience with Beth Israel, where we were sort of like all of a sudden presented with a fait accompli that we had to respond to. So I guess I just want to stress to both of you and your upper level management at Sinai that it's really important and critical to bring the community in from the get-go on this stuff. Around your whole transformation plan that you're referencing here for the downtown network within Sinai, like, okay, you have this transformation plan, but I don't think any of us know what the elements of it are or are briefed on it on a regular basis and in conversation with you all on a regular basis to help develop that plan and tweak it as necessary. So I really want to urge you to and please don't look at us as like people we're going to just nag and criticize and say no. We can help you.
Mark.
Okay, Mark, could you wrap
Mark,
up?
can I
Other
briefly-
people are raising their hand.
Let me, Mark,
all
let me
I
just
really
make
want.
2 quick comments. One is, I started this with saying that we don't have anything to discuss with you with the transformation yet. We understand from the last time, and our plan is that once we have a blueprint to start to talk to you about what it is and hone it off of that. New York Eye and Ear, unlike Mount Sinai Beth Israel, and it's the same point I made before, is there is no, even though it sits on 14th Street and Second Avenue. It serves people throughout the entire city. I could send you, I don't have it with me, access. I know I've sent it to Harvey in the past. I could show you what the zip codes of where our patients are coming from. They're coming from all over the 5 boroughs. They're coming from New Jersey. They're coming from Westchester. We can't sit down and have a planning session for what we do with that. Every time you move a program with a hospital like that, unlike Mount Sinai Beth Israel, I'm not saying Mount Sinai Beth Israel is not a community hospital, but when you talk about a hospital like that, for every patient you do inconvenience, there are as many patients, if not more, that you're making it easier or more convenient for them to get to. So it's a little different. New York Eye and Ear is a different sort of story. And with that being said, we're not looking to shut New York Eye and Ear. We're not looking to shut the facility down either. We're looking to improve the level of service the people who go there are going to get. And right now, we think that will be met by opening up the ambulatory surgery center and moving some of the ear service over to Union Square.
All right, are you done? Okay, do we have someone else raise their hand? Okay, the
Mike
next person is Mike Schweinsberg. Mike?
Thank you kindly. Hi,
Hey, Mike.
hi, Brads, both of y'all.
Hello.
We know each other from the fight for Beth Israel, and I'm seeing a lot of the same tactics employed here that we experienced with Beth Israel, namely the self-inflicted financial wounds, closing down profitable units so it can be presented that you have a lessening financial capability. Be that as it may, one of the things that you keep harping on is that you're making it more convenient for some people to be there. Here's where you're wrong, particularly with people who are blind, because whenever you start to fractionalize the services and force patients to go from location to location to location to get the same services, that I kind of laughed out loud. You couldn't hear it because I was on mute when you said it was going to be a one-stop over on the west side. Well,
I didn't say
guess
the,
what?
first of all, it's not the west side, it's Union Square.
No, you talked about 25th Street
And
for
that's
ambulatory.
only, but that's just surgery. That's outpatient surgery.
right.
which-
Just surgery, right?
Yeah,
Just
It's an
surgery.
ambulatory surgery. center.
Ambulatory
Right,
surgery.
right.
Yeah.
And you also said other care was available there. So,
No, I said,
Uh,
excuse me, Mike,
yeah,
I said at Union Square with the Ear Institute, other services are available.
okay.
I never said that
So-
about the ambulatory
fo-
surgery center.
I'm sorry to interrupt, but they only give me 2 minutes. So, but there is follow-up care required. I mean, okay, they have the operation over on the west side. Then what? They have to have all the follow-up and first of all, they have to be examined elsewhere before it's determined that they need the surgery. What I'm saying is you're fractionalizing the services required for particularly people who are blind. And the reason that's a big problem is that people who are blind are very likely to experience, because they're blind, a higher risk of falls, of traffic accidents, of all kinds of, and I'm sorry, but I've lost my full notes here. Fractures, declining mental health as a result, cognizant deficits, and social isolation. The more they have to deal with this, having to go hither, thither, and yon to get their eye care. So what you're proposing here is to set up a system where they're going to have to go from this place to that place, and that does not work for the blind, okay, or people with low vision.
Okay, Mike, you
so
should wrap up.
Okay,
Because
so
you're beyond your 2 minutes.
thank you. You're just presenting a particular set of difficulties to a community that doesn't deserve to be treated that way.
All right, okay, before we get on to the next person, Larissa, do you have the clock? Larissa?
Yes, sorry, I was on mute. I do have the clock. I'm going to go ahead and share my screen.
Okay, so the next person is Penny Mintz, and from now on, we're gonna put up a clock.
You could hold just,
That shows the 2 minutes. So this way we're,
Sure.
you know, a little bit more, you know, even-handed with everyone in their
and,
testimony.
yeah, absolutely. And if you could just hold for just a moment while I start sharing.
Okay.
Can I start talking even though the clock's not on yet?
Yeah, I'll just start.
No, if you could
Uh-huh.
wait, well,
Oh, okay,
I
up
can
to
start
Larissa.
it, but yeah, sorry, I'm just trying to find the right screen to share. My apologies. Okay, there we go.
It might not even take 2 minutes. Oops.
Okay.
Okay,
Larissa,
one of the things that hasn't been
wait,
mentioned-
excuse me, we can't see the interpreters anymore.
Exactly. Yeah, that was one of my
Oh, okay,
Sir-
so maybe we can't do the clock,
concerns
right?
because once I share my screen, the spotlight are no longer on.
Yeah, we need a
okay.
different.
Yeah,
time
that's
clock.
a problem.
Okay,
Yeah.
okay, you guys lucked out. There's no clock. Okay, so,
we
there's
can
no
run the-
clock that you can see.
I
So
could
we
run the
will,
clock if
Okay,
you
so
would
let's
like.
start it at the beginning again.
I
please.
can remind them at the 30-second. That would be okay?
yes, that would be okay.
Okay, I'll
Something
let you,
that has
I'll
not,
give you a 30-second warning.
thank you. Something that has not been mentioned, and I'm kind of surprised that it wasn't mentioned by Dr. Lee. And what I have found most compelling about keeping New York Eye and Ear in one place is that patients would go from one doctor to the next doctor, and it just, the doctors could confer with each other, and doctors were teaching doctors, and it has been historically an extremely successful, integrated hospital for this specialty, yes, of eye and ear, but by taking the parts and splitting them around, you're separating the doctors, not just the patients, but the doctors, and they are losing a lot of their of what made them extraordinarily effective by doing this. I cede the rest of my time to whoever is the next.
And again, Penny, we're taking notes, and obviously we'll get back to leadership with these comments.
Maybe Dr. Lee can speak for the remainder of my time about.
No.
He's most articulate.
No, who else has, we're trying to let as many people as possible speak. Okay, so who would like to be next?
I don't
There are
see.
no
any
other
other-
questions?
There's no other hands.
Okay. So if there are no other hands,
Oh, Andrea,
We just,
And
Andrea,
obviously,
that's
Andrea
the
Andrea
hand up.
Lyman.
I
Okay,
was gonna
Andrea
say, to
Lyman.
add to what Brad said, before I'm Andrea, you know, obviously we will
I
clearly
heard.
take all the comments back to people with what you've brought up.
Okay. Andrea,
And Andrea,
Lyman.
I'll give you a 30-second warning as well.
Okay, great. I'm a little conflicted about bringing this up because this is a complicated issue, and the Brads may know that there is an issue that just came out of the JAMA Journal of Medical Ethics, largely written by graduates of the Sinai residency program about segregated care in New York City, but that's a larger issue. So I am going to bring up the question of your new ambulatory sites. What are the plans for the so-called clinic services? Are they going to be maintained? Can you make us a promise that it won't only be faculty practice with restricted to people with certain insurance? What are the plans for servicing the Medicaid and uninsured populations?
So on that, obviously there's going to be a combination, but virtually all of our practices will take, provide care to the uninsured as well as Medicaid. But some of the practices are faculty, maybe faculty practices, but virtually, everything will take Medicaid.
And we've always taken uninsured as well. That's not going to change.
When you say it's not going to change, the proportion won't change? Do you mean that there'll be some available? How do we know? Is there a guarantee that there won't be a restriction in such services?
I don't have exact details and I can't go on the record with something that I'm not aware of. I do know that we've always, the patients we've taken care of at New York Eye and Ear or at Beth Israel or our other facilities will be able to be taken care of.
And if you look at the
Not
data,
looking to change that matter, we're not looking to try to change that.
right,
So Andrew,
you-
what I've been told is that the resident clinics would be moved to 380 Second Avenue. Brads, are you aware of that or no?
I don't think there's any final decisions there.
There's no final,
Okay, but that's what was proposed to the residents.
I mean, there've been a
Okay,
lot.
from
of
the, okay,
no final
okay.
decision.
Okay, I just want to remind people about this meeting. It's not a conversation, it's a conversation with everyone. So the way it works is that if you wish to speak or ask a question, you raise your hand. And then your question will be answered. Okay. Okay, Penny, are you done? No, please. Okay, anybody else? Other questions? Other comments? You can raise your virtual hand or your real hand.
I don't see any.
No, I don't see anything either.
Oh, yeah, Arnett has her hand up again.
Arnett?
Hi, quick question. As you said before that the plans haven't been finalized. I'm sorry, this is for, I guess, the Brads. I'm just following suit of what everyone else is saying. I think it's cute now. But do you have a timeline in which you will come back to the community board with more details on the plan? I know you said the plans are
you mean,
in the
are you asking New York Eye and Ear specifically or the transformation?
both, actually.
Well,
But
we have
we'll be
always
back.
said two things. One is we'll come back anytime you want us to come back. So,
Mhm.
we're happy to come back and talk to you. We can only tell you what we know, obviously, but obviously once there is a blueprint for the transformation, we will be coming to you. We will be coming to CB6. We will be out and meeting with the groups that, this all started with, but we don't have that yet. So I can't do that. As we're moving forward with CONs or stuff, and we've spoken to Harvey about that, we're going to make that clear. We will let everybody know when CONs are filed for
Right.
anything.
But we just want to be careful on the timeline because we don't want to say we're going to be back in 2 months or 6 months with a plan. Because we can't guarantee that's the
Right.
timeline, so other than we will be back when there is some sort of blueprint.
I mean, we'll come back and talk to you. And as I said, anytime you want us to come, but if we don't have any more information, there's not much we're able to do for you in that regard.
Okay, and I'm sorry, one other question. What I found, quite interesting is that most of us here are talking from the lens of someone that is able-bodied. And in this new transformation and or the changes to eye and ear, it affects a lot more people with disabilities. How have you communicated to those communities about what the proposed changes are? And if you have communicated with them, what was some of their feedback on how to either do it better or against the actual proposals?
So really for the transformation, and Brad, jump in here too, we have been really doing most of this through, actually, it goes back to the previous borough president put together a working group that was comprised of all of the local elected officials, the community boards, various community groups. Penny was part of some of those meetings, and that's where we got most of the feedback. There was, I recall, and Brad, I forget the name of the group, but there was a group who did give some feedback regarding some hearing impaired issues that we took under consideration, but I don't recall the group, but it was most of it done through the working group at that time put together by Gail Brewer.
But as for anything that affects patients, there's a prescribed manner with which you inform patients and everything about what's coming on with plenty of notice before anything happens.
Thank you.
Okay, we have two more hands up now. First Penny Mintz and then Mike Schweinsberg. So you spoke before, so if you could, so you should speak about something you haven't spoken about before.
Right.
No need to repeat.
Right. I'm not planning to repeat, but I believe that Mark Hannay had said that it's important to have the community groups involved before the decisions are made. And what I'm hearing from you is that you're going to, things haven't been decided, you'll come back when they've been decided. But I think what we're saying is that the community should be involved before, so that you can hear what the problems are and make adjustments before you finalized any kind of plans.
Penny, what I said was somebody has to make a blueprint. There has to be a start from which you jump off, a jumping off point. That and that is where we're going to come. Again, it won't be a final plan. It will be a proposal, and then we will discuss it further with the groups. That, that we believe me, we've also gotten plenty of input over the past couple of years, from the previous plan. So we've heard a lot of things.
Can I just respond just very quickly?
No, okay, no, okay, because we have two more people.
This is misleading, because we know from what happened with Beth Israel that what they did, they came, they spoke as often as as they were invited, but it was always
30 seconds.
They had to fight against, rather than a plan that we could have conversations, have input into, and yeah. So I see that happening again. That's their modus operandi. It's not. They're not working together at all. Thank you.
Okay, next is Mike Schweinsberg. After that, Susan Stetzer.
So briefly on Penny's points, there's a certificate of needs protocol that allows them to go ahead and make these changes without any community input, without any community approval. And as we experienced with Beth Israel, they go ahead and do that. And then they come and tell us they've done it. So, we're going to experience that again. Okay, here's my other comments. As Community Board 3 is well aware, the population of seniors with disabilities in the Lower East Side, you can speak about everything you want to speak about with regard to New Jersey and the other 5 boroughs, but in the Lower East Side, along Avenues A and D is 38% higher than anywhere else in New York City. And when you add the adjoining blocks, it's 44% higher than anywhere else in New York City. Now, add to that fact that the Centers for Disease Control in New York State have presented a study that shows that a huge proportion, approaching 50% of the population, have undiagnosed eye problems, that will lead to blindness or severe loss of vision. So if you take this away from a community that has such a high population of people with disabilities to start with, then you're really damaging this
30
community.
seconds.
That's all I want to say.
Okay, Susan?
Yeah, I'm wondering if there's a need for another work to ask an elected official to be convening another working group, and whether the community board might want to ask either the borough president or someone else to do so.
I
And
will
Brett,
say that I
you've
did
done
have
that, right?
Wait, who's, who
I
are
did
you
have
asking?
conversations with Mark Levine, when he was transitioning to let him know that, Gail had done that. And as we move forward that, if he wanted to take control of that. We haven't had that much follow-up of that, but because there hasn't been anything, really to discuss yet, but we did discuss that briefly.
But maybe boards 3 and 6.
That's fine.
To follow up also.
That's
Okay.
cool.
Yeah, Susan, I think that's, it's good. Now that, things are, happening again, it's a good time to ask. Right. Sorry. I don't see any more hands raised.
No.
Okay, so we have things to follow up on. And one of the things for Community Board 3 definitely is to inquire about or to talk to the new borough president about the working group.
Thank you for.
And we have everyone's comments today as well.
Yeah,
Yeah,
thank
I
you
would
for
assume-
debating this.
Okay.
Thank
All
you,
right, Thank
guys.
you.
All right,
Okay,
thank you.
Thank you.
Take
Thank
care,
you.
guys.
Okay, bye-bye.
Thank you.
All right. So next on our agenda are the CAB or CEC reports. Did anyone go to a CAB meeting? Let's see, we have the Bellevue CAB.
Hey, that's me. Hi, happy 2023. Bellevue, the last 2-3 CAB meetings have been held in person and they have been going over the state budget training that they have a few of the CAB members attending. There is an upcoming blood drive happening on the 11th of January. They are asking for at least 7 members of the community of New York to please go give blood. And they have been on several news stations and have been promoting a plant-based diet program that has been researched that controls diabetes. And this has been a program that has been on Pix 11 and Channel 5, and they are promoting it as part of a new department in Bellevue. And that's it for now. I have the training of the state budget next month, and I'll come back with information from there.
Okay, thank you. Oh, Laura, are you also still going to the other CAB, the one that meets quarterly? It's the downtown hospital CAB?
They haven't held any, the Lower Presbyterian?
Yes, yes.
No, I haven't heard from them other than along with the state budget training as well, but they haven't held anything.
Okay, thank you. Okay, so next is the Gouverneur.
Thanks. We have not met yet this month. Our meeting because of the new year falling on Monday. We will be meeting this coming Monday. Our agenda will be our budget advocacy day preparation and our budget asks. We will be going this coming month to the training. It's open to all of our members. We are also focused on our first floor expansion recommendation, which we will be, once we prepare our questions and our presentation, we will be reaching out to you, May, to schedule some time here on the board to make a presentation and to receive feedback from the public.
All right. The Mount Sinai Beth Israel CAB.
Can I ask Larissa a question?
Oh, okay, go. Yeah, please go ahead.
Larissa, I heard
Yes.
that the social workers at Gouverneur are working with asylum seekers and that there's a particular need for shoes. Is there any way that we can help at least spread the word, find out exactly what the needs are? Is there something we can participate in?
I can work with the communications team. Rafael Rodriguez and I have a very good working relationship. And I will speak to him. Would you mind shooting that to me in an email, Susan? And I can forward that to him and I'll loop you in.
Yeah, they
And
actually
we'll
reached
see
out
how
to
we can
Gail.
advertise it.
They reached out to Gail
They
Brewer.
reached out to Gail.
Who
Was it
reached out-
Rafael that
who-
reached
no.
out to her?
I don't know who reached out, but someone reached out to her.
Okay.
And then she reached out to
Okay.
me.
Well, he has a new representative that just came on board. It may be her, we're being introduced to her this coming month. And I plan on meeting with her personally on Friday.
With who-
With the new representative of communications. So
Okay. Yeah, so.
I
it's, you
can
know,
find out. So the social workers are looking for shoes and other items, and I'll find out how we can advertise that and who we need to connect with.
Yeah, if there's something we, that's already being planned, if any of the elected officials are working with them,
Uh-huh. Okay.
Yeah.
I'll put something together.
Yeah, so since we're on, I still want to finish the CAB reports, but since we're on this, Susan, on this topic of the asylum seekers, it would be good if we could, I mean, shoes is just one thing, there's like many needs, and if we could find out, in a centralized way, what all the needs are, otherwise we'll be just getting information in dribs and drabs, and it will be overwhelming to all of us.
True.
Yeah, so I know they need Metro cards, they need coats, they need shoes, they need supplies, there's like this and most of all money. But so yeah, maybe it's through your district service cabinet, I don't know, but it would, so besides the, responding to Gail and Gouverneur, I mean, it'd be good if we could do something else as well, so we don't get overwhelmed with these constant requests. I mean, it is known what they need, in general. And since there's going to be this whole population that's, moving into this hotel, it would just be good to know.
Well, and I don't know the people at Gouverneur, I don't know where they're living. So that's another issue.
Right,
that we
right.
should know. I will say, there are at least 2 elected official reps on the, still on the call. Maybe they have information, because I would imagine they would be the first to get information for help.
Okay.
We have both Harvey's office and Brian's office are still on.
Excuse me, I'm sorry, which is the hotel that they're going to be moving into?
The one on Grand Street, 231 Grand. There was the one that Housing Works was supposed to open up, but and then it got changed. You remember that one?
Oh, yeah, we don't know that the people at Gouverneur, I'm sure that that's not, they've already have issues. So I think that was even before people moved into Grand Street Hotel.
Yeah, and they're not really moved in. I mean, they're still moving furniture in there. So, it's still, but anyway.
I'll just report from Kavanaugh's office that that information hasn't come to us voluntarily. I'm sure we could seek it out, but we have not gotten any sort of update automatically about that.
If you could help us, it would be really good to kind of try and centralize this information, instead of us all working separately.
Yeah, I'll see what I can find out tomorrow and next week and get back to you.
Thank you.
Okay, and then you said there was someone at Jackson.
Well, if Brian's doing it, they could all
Oh,
work
okay.
out together.
Okay. All right. Okay, so let's go back to the CAB reports. I know last month Carmen reported on the Mount Sinai Beth Israel CAB. She was going there to sub for Shirley. Shirley is not here today. And Carmen, did they say when there would be another meeting? Carmen Perez.
She's here, but not here.
Okay.
No, I'm here.
There she is. She's having technical difficulties.
Okay.
Horrendous this evening.
right.
But what was the question? 'Cause I couldn't hear it.
Okay, the question is, you went to the you already reported on the Mount Sinai Beth Israel CAB meeting that you went to about maybe a couple of months ago. So did they say
Yes.
when the next meeting would be?
It was certainly going to be after the holidays, but I didn't get an exact date. Because it was
Okay.
mostly focused on saying goodbye to the outgoing assemblyman.
Okay, all right, thank you.
Sure.
So Susan, were there any, I don't think there were any shelter CAB meetings, right?
No, they haven't actually resumed since COVID. But
Okay.
I don't know if you want to, well, I guess, I don't know if it's a good time, just mention the issues that project is renewal, or maybe not, just wait till the next committee meeting.
Oh, about the cannabis?
Yeah,
Oh, yeah, we can wait till that.
okay. Okay. There's
yeah.
one person from the public has Michael has his hand up again.
Was that from before, Michael?
No, that's a new one. I just didn't want to leave without thanking Susan and you, May, for providing ASL interpretation tonight. Greatly, sincerely appreciated.
Thank
Oh,
you.
we didn't actually provide it. The providers are
Yes, we.
You
signing
arranged
to you
it.
right now.
You
Yeah, we
arranged it.
Yeah.
We arranged it.
Okay.
I'm sorry, the office did arrange that, May.
That's
Yes,
right.
yes,
So,
yeah, yes, Susan arranged it.
so thank you kindly. I really appreciate it. Thank you.
Okay, glad to help.
Okay.
Okay, we did want to report on this meeting we had with earlier, it was right after the last meeting, I think it was with Educational Alliance and their Avenue D office. It was like a little Zoom meeting with Susan and they requested to, and I was there as well. And Arnett probably knows a lot about this project too, but they're, because she works there. But they are starting a, well, they're doing more outreach in the community. They have more funding. But one of the things they wanted to start with like kind of a coalition around some of these mental health and wellness issues. So, you know, traditionally, I think, or, you know, they have always, you know, worked on, you know, like, you know, substance use disorder and things like that. But it sounded like they wanted to expand a little bit and grow this coalition. You know, so for example, I did mention to them, you know, because we talked a lot about mental health in our previous meeting and how there were a lot of needs. And I mentioned the senior citizens. I know Carmen talked about the senior citizens. So you know, so they do want to reach out to the older population and are looking to have more people join this community coalition that they want to build. Susan?
Yeah, I think, you know, everything sort of runs together. I think I went to their first coalition meeting and you weren't there.
No, I didn't go. Yeah, I didn't go.
So I'm going to tell you, I think it's premature to expand. I did call, and I'm blanking on her name. I did call and speak to her afterward. They're working on like visions and mission statements, and I'm not sure yet that they have figured out what it is they're really looking for. And my suggestion is that they might want to spend more time with the group that they have now to figure out exactly what it is they want to do before they start reaching out to more people.
Oh, okay, thank you.
I'm sorry, Susan, that was probably.
Yeah.
You're on mute.
Muted yourself.
Oh, Stella, I think you probably spoke to Stella.
Yeah, yes, I did. I had, she's very, very nice. And I did have a follow-up conversation. You may want to speak to her. I did have a follow-up conversation with them. And I think, you know, they have some great ideas, but, you know, sometimes you need to figure out exactly of a wide range, what it is you're doing before you invite other people in. I did say, you know, they certainly want to help out in Tompkins Square Park, particularly, I think, with the needle collection, because there are some substance abuse programs there, so they're very focused on that. So I did tell them I would connect them with that group to volunteer. But right now they're really working on statements and missions, which I agree with them as their first steps.
Okay.
Should I raise my hand?
Yeah, go ahead, Arnett.
Okay. Well, I directed Stella to you in May, and I purposely didn't want to get too involved in it because what I understand is that they're really trying to connect with the community more so than they have in the past. And in that they have a pretty big vision of what that looks like. And that's why I got, you know, steer them over to you to help them hone in what they're able to do, what they would like to do, and what they can start to do. And so right now I sort of concentrate on Tompkins Square and see what we can do in that immediate vicinity so that we can build on that and just try to keep in contact with the board and see how that's working and then move forward from there.
I would encourage them, aside from when we're speaking, but, to also reach out if there's questions or anything we can always be helpful on.
Okay. All right, great. Okay, so we heard a lot from District 1 today, but Arnett, was there any additional, reports from the CEC that we did not talk about today?
No, not, our last meeting, we were electing additional CEC members, so we didn't discuss much. It was mainly about the election, the protocol, and the outreach. Our next meeting is January 12th, so I won't have anything to really report until February.
Okay, thank you. All right, so we're coming to the end of our meeting. Is there any other updates news? New business, old business? Okay, if not, we can have final roll call and then adjourn the meeting. Thomas?
Okay. Maylee,
Here.
Thomas, present. Larissa,
Present.
Annika Little,
Here.
you, Eric Diaz, Eric, okay. Larry Fenn,
Present.
thank you.
No.
Shirley Fennessy,
Come back here, David.
Shirley, all right. Deborah, Deborah,
She's ill.
she's what?
She's ill.
Okay, thank you.
Is out sick.
Alicia Lewis Coleman, okay. Alicia, Laura Lugo,
Present.
thank you. Heidi Schmidt,
Present.
Arnett Scott,
Present.
Rodney Washington,
Present.
thank you. And Carmen Perez.
Present.
Okay, thank you, Thomas. Okay, so the meeting is adjourned and yeah, so we'll see you at full board. Okay, bye.
Yeah.
See ya.
See ya.